Welcome back. The National Hospital Network, representing 241 public hospitals already under strain from Africa's worst COVID-19 epidemic, says it's running out of oxygen and drugs, most of which are important through Durban, as well as food. Doctors and nurses have been unable to travel in KwaZulu-Natal and Johannesburg. To hear more about this, Dr. Mvuyisi Mzukwa is the Deputy Chairperson of the South African Medical Association. He joins us now. Very good evening to you, and thank you so much for speaking to us. How dire is the situation?
Good evening, Chairperson, and good evening to your viewers. The situation is really dire in KZN and also, some parts of Gauteng. But KZN, I think, is the worst. What is happening now in the hospitals is that healthcare workers cannot access hospitals. Because of the blockages of roads, but also because they don't have fuel. Last night, we had to have urgent meetings with the suppliers of fuel to urge them to consider prioritize healthcare workers so that they may be able to go to healthcare institutions. But also, what is the problem now is that in the hospitals, there's no food. There's shortages of food. There's shortages of staff. You've got bed availability, but you don't have, those things that are needed in a hospital environment, like your food and personnel. So that's where we are now. But also the threat that buildings are going up in flames around healthcare institutions. It puts severe strain, not only physical, but also emotionally, to healthcare workers who are inside the healthcare institution.
And I'd imagine that you can't even rely on clinics, private practices or surgeries, because I understand that those too have been vandalized, and equipment, medications, and even some of the furniture has been stolen.
That's very true, Tsepi. So we have a huge challenge where doctors' practices have been vandalized, equipment stolen, pharmacies they've been broken into, medicines taken away, chronic medication in private pharmacies and in the doctors' rooms. So that is where we are at the moment. It's really, even colleagues are afraid to even go and see their practices, because of the violence out there. So it's a very dire situation.
So what is the reality? Does that mean that those institutions that are working on skeleton staff, primarily because I understand that doctors and nurses who are needed in KwaZulu-Natal and Gauteng can't even travel to work?
Yes, the challenge is that when you need to admit a patient, you phone around looking for a bed. They will tell you, we've got beds, but we don't have staff, we don't have food. So if we admit that patient, what are we going to do with that? Because there's also shortages of medicines in the hospital because there's no delivery. So it's a very dire situation. We don't have things to do emergency operations like that. There's a shortages of those. So colleagues can't even perform emergency operations in the hospitals.
I hear some hospitals or hospital groups like Netcare saying that they have put contingency measures in place, but what can be done realistically to help alleviate this problem?
What we have done already as the South African Medical Association, we've been meeting different stakeholders. For example, the fuel suppliers. Last night we had a meeting where we requested that they prioritize healthcare workers, give them fuel so that they may be able to attend to their duties. But also, we have had a meeting in some of these places, like the Premier in KwaZulu-Natal, to say let there be plans in place, to assist healthcare workers and the institutions in terms of security and making sure that those institutions are not vandalized, but also making sure that healthcare workers are protected and the patients, by the way, are protected in those institutions. We also have gone to as far as requesting an urgent meeting also with the National Department of Health to really look at this issue, because it does not involve one province. We don't know if it might affect other provinces. So we need to have a plan in place.
This next question, I know it would be difficult for you to answer, considering the fact that it's the National Department of Health that releases the figures and the National Institute of Communicable Diseases that also looks at the data. But the World Health Organization is warning of an increase in COVID-19 infections as a result of these riots and public violence incidents that we're seeing. Is there any way that you're able to tell that there is an increase of these incidents of infection?
Well, it's too early to even have that data available with the NICD even, because you must remember that it takes a few days for you to get symptoms and all these things in terms of being diagnosed with COVID-19. It will take about 7 to 10 days for us to see what is happening, on the ground. But as you can expect, there will be a huge rise of these cases, and again, we might have a problem accommodating these patients when they come in numbers in the healthcare institutions, because of the obvious reasons that I've stated earlier. We need to have a plan in terms of making sure that the hospitals are functional, and also that the ICUs and high cares are ready to accept severely affected patients by COVID-19.
Thank you so much for taking the time to speak to us and sharing that with us. Dr. Mvuyisi Mzukwa, he's the Deputy Chairperson of the South African Medical Association.